National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, health expert here at Nationalnutrition.ca. In my practice, because I focus a lot on autoimmune conditions, I treat a lot of a condition called Crohn's disease. Crohn's disease is one of the major subtypes of inflammatory bowel diseases. Crohn's disease is an autoimmune condition whereby the body is attacking and destroying the small intestine and the large intestine. It's characterized by having large ulcerations in the intestines, and over time, with repeated ulceration of this tissue, it leads to a variety of complications. It leads to thinning and weakening of the intestinal lining, as well as a lot of scarring, which can create a lot of dysfunction. It can also create a condition called a stricture, whereby there's a narrowing in the intestine. And of course, as you can imagine, it makes it more difficult and often very painful for food to pass through an area with stricture. So Crohn's is a very severe condition. Often, if left untreated and unmanaged, it will typically result in needing severe surgeries whereby they'll actually cut out the inflamed and damaged area and then reattach the intestine together, what they call a intestinal or a colon resectioning. And so it can lead to some very invasive surgeries, and it can cause a lot of problems because, of course, if the intestines are not working properly, one of the things you're going to run into is that you're going to get malabsorption. So one of the problems with an inflamed gut is that the gut, you're not able to properly digest and absorb the nutrients from your food, and so that's going to lead to a number of other disease states based on some level of malnutrition. As well, of course, with having severe inflammation, there's a higher likelihood of having intestinal bleeding, as well as having intestinal infections as well, because of course that barrier immunity, the normal integrity of the intestine is corrupted. And so that's going to make it permeable to a lot of different types of infections, and that's going to lead to a number of problems. Other behaviors can aggravate Crohn's. So excessive consumption of alcohol or cigarette smoking can be very problematic as they impair recovery of collagen, as well as they can be pro-inflammatory. So they can increase the level of inflammation in the system. And of course, one thing, anytime you've got chronic inflammation, you do actually have an increased risk of cancer development. And of course, as we all know, smoking does not help this. So in my practice, we often help manage people's Crohn's disease through dietary intervention, often eliminating gluten, dairy, and what we call the nightshade vegetables, your tomatoes, potatoes, peppers, and eggplant. And oftentimes gluten and dairy can be associated as triggers with Crohn's disease. And then the nightshade vegetables can be pro-inflammatory for a lot of people. Now, these dietary changes don't necessarily fix the problem for everybody, but there's nothing you're going to miss out of your diet that's nutritionally essential if you avoid these foods. By eating a healthy diet with plenty of fruits and vegetables, and healthy sources of healthy fats and proteins, there's no harm in eliminating gluten, dairy, and the nightshade vegetables temporarily, at least, to see if that does help improve your symptoms. Other things you can do are, again, to try and manage the inflammation. So you're going to want to use anti-inflammatory enzymes, bromelain and serratia peptase, often best taken on an empty stomach. I typically recommend my patients take these first thing in the morning on waking. That way they can guarantee their stomach's as empty as possible, and that allows these enzymes to be used primarily as an anti-inflammatory instead of as a digestive enzyme. I'll also typically recommend a herb called Boswellia serrata, as it's a great anti-inflammatory for the intestine and the colon. And then I'll try and help the body heal from this problem using L-glutamine, which is an amino acid that is both a structural and a fuel amino acid. And by that, what I mean is L-glutamine is needed by the intestine to heal, as well it's needed by the intestine as fuel. So the actual gut cells, the intestinal cells, can use glutamine as a source of fuel. So this gives them the energy required to heal from the inflammation. And then the other thing, of course, is to try and reduce scarring. You want to ensure that the muscle of the intestine is growing back properly and maintains its elasticity. And in order to do that, you need collagen. So I'll typically recommend my patients take a collagen powder. The reason behind collagen powder is, again, it provides all the amino acids for your body to be able to manufacture collagen, manufacture that elastic tissue to prevent scarring and stricture from happening. So these are some things you can do to reduce the severity of your Crohn's disease. So I hope these hints and tips will help you along your journey. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.